We are so fortunate that we also will have three wonderful interdisciplinary discussants to begin that conversation and to help tie together some of the themes and ideas and the wisdom we've seen thinking about next steps and ideas and new opportunities for culturally and regionally relevant health and wellness in the Pacific, especially with sports. So first, we will hear from the fabulous Dr. Mapauana Antonio. She is an associate professor and head of the Native Hawaiian and Indigenous Health Program here at UH Manoa, and soon to be the acting associate department chair. We're very excited. Dr. Antonio is a Native Hawaiian scholar who works and conducts research with and for Native Hawaiian communities by applying principles of community-based participatory research. Her research takes a strength-based and holistic approach to health, healing, and well-being by bettering the physical, mental, and spiritual health and well-being of Native Hawaiians with a focus on resilience. She has many amazing projects and training and a background, including in psychology, public health, Native Hawaiian and Indigenous health, community-based participatory research approaches, qualitative research, and quantitative research, including psychometrics. Then we will hear from Dr. Krista Schoopy. Dr. Schoopy is a pediatric otolaryngologist who was born and raised in the Big Island of Hawaii. She studied anthropology and human biology at Stanford University, then earned her MD from the University of Hawaii John A. School of Burns of Medicine. She went on to complete residency and fellowship training in pediatric otolaryngology surgery at Stanford University before returning home to serve children across the Aloha State. Her work focuses on conditions that affect a child's ability to sleep, hear, speak, learn, and participate fully in everyday life, including obstructive sleep apnea, congenital hearing loss, and complex airway disorders. Dr. Schoopy is also completing her master's degree in quantitative health sciences at the University of Hawaii, and through this, she's part of our public health MPH leadership class, helping to host this event, and we're really appreciative that she's here in all these capacities as a discussant and as a class participant. And then finally, we will learn from our esteemed colleague in social work, Dr. Vakalahi. Dr. Vakalahi is a Pacific Islander woman born in Tonga, raised in Hawaii. She's the president of the CEO and the CEO of the Council of Social Work Education. Prior to joining the Council on Social Work Education, she was a professor and dean of the College of Health and Society, an interdisciplinary college at Hawaii Pacific University, and had many other important leadership and academic roles. Her areas of teaching include social policy, human behavior, and social work in the environment, as well as organizational leadership. Her two areas of research scholarship in particular are Pacific Islander culture, community, and women of color in academia, in which she's contributed extensively to the existing literature through peer-reviewed articles, chapters, books, references, and other medium. Among many things, Dr. Vakalahi is deeply committed to the future advancements of justice, equity, diversity, and inclusion, which in essence has been shaped by the extraordinary people and places that have invested in her. So I'm going to turn it over to each of the discussants. You can see the amazing wisdom, knowledge, experiences, and ideas they will have to share with you. To each give some thoughts, weaving these together. And then Dr. Vakalahi will open for general questions. Either you can participate by putting into the chat or by putting into the webinar Q&A. So mahalo, and I will turn it over to Dr. Antonio.
All right. Aloha mai kako. Thank you so much for that wonderful introduction. As mentioned, I'm Mapauana Antonio, Associate Professor and Head of our Native Hawaiian and Indigenous Health Program here at the Department of Public Health Sciences. Today, I'm zooming in from beautiful Manoa. I'd like to send a warm mahalo to the various organizations for today's gathering and to everyone who helped make this possible. This has been a meaningful time and opportunity for us to gather today, and especially around this important topic. So I've been tasked with the kuleana and responsibility of serving as a discussant, and I'm bringing my public health holistic health lens as I feel honored to be able to provide some thoughts and reflections on the valuable insights, stories, and sharings that were provided today. So I see this as an invaluable opportunity to elevate and uplift three themes that resonated strongly with me. First, sport as a site of identity and resistance. Rohini reminds us that physical activity is an act of health equity, especially as we consider gendered and culturally embedded norms. Sports is a contested space shaped by legacies grounded in gender, race, power, But on the flip side, sports and movement can serve as a space of creativity, renegotiation, and transformation, particularly as we reconstruct health promotion to move towards agency, dignity, belonging, and pride. Second, sport as an education and relational practice. Jeremy's journey demonstrates the importance of centering traditional games as a critical part of life and identity. Festivals that elevate traditional games as a pedagogy provides opportunities to promote collective engagement and cultural exchange, but also in ways that sustain our ways of knowing, especially related to these practices. I especially appreciated the opportunity to think about inter-university and community curriculum of traditional sports and the ways in which this can provide valuable opportunities for mentorship to cultivate values, community leadership, with an emphasis of working alongside lived experience that bridges practice in a powerful way. Third, sport as public health and youth opportunities. John's work in collaboration with FAS shows us what culturally responsive, inclusive, and community embedded sports can look like in action, particularly when we center our youth in positive activities. As an athlete and social worker, he beautifully intertwines the intersections of these works while demonstrating the ways in which sports can function as prevention, protection, possibility, and a celebration, especially for our young ones. Across these presentations, I see a shared call to shift the narrative and move toward resistance, resilience, and transformation for sports and movement, while we co-create, co-support research, policy, and programming around physical activity that promotes equity. Lastly, I see a call to center Indigenous knowledge as we consider decolonial works related to sports and movement. Today's conversation comes at a very timely moment, and reminds us that physical activity, which can be culturally rooted in community-led movement, is medicine, memory, and future making. So mahalo to you all. Mahalo to those who have put in the work to gather us in this space today. I look forward to seeing all of the continued works in this area and our continued discussions.
Hi, thank you. And thank you so much today to all the speakers. That was wonderful. Listening today for myself, I kept thinking about things not just as a doctor, but also as a parent raising a child here in Hawaii. But really in medicine, we focus on individual outcomes, really concrete sort of measurable metrics. But public health really kind of helps us to remember that health is shaped long, long before the child enters our clinic. And really what we've heard today shows that in our Pacific communities, especially, health is really collective. It's deeply tied to identity, culture, and relationships. I think Dr. Ballroom really reminded us that sport isn't neutral. You know, we don't, not everywhere in the world has Title IX like we do in America. So really, gender, culture, and race can shape who participates in programs, who wants to participate in programs, and, really focuses on the fact that these programs need to be culturally grounded and community centered to support like real true health. Dr. Durobalomo showed us how traditional games in Fiji can do more and build fitness, really to preserve heritage, foster that personal pride in one's culture and strengthen those social bonds. And really, Mr. Howard's story was inspirational and sort of highlighted how sports can turn either personal victories or setbacks into opportunities for youth in teaching resilience to future generations, teamwork, and self-confidence. From a clinical perspective, I really think that the kinds of protective factors that will shape lifelong health are things that will promote any sort of mental well-being, self-esteem in kids, social connection, and habits that can reduce the health risks over decades. As a pediatric specialist and as a parent, I see that really what I want for my child and for all children that I take care of is more than just wellness. It's the connection to other children, the connection to their communities, a pride and a sense of belonging. And, we see that in team sports, but these talks really kind of emphasize that. I think that the public health lesson, is really is pretty obvious here. It's that, we need culturally grounded sport and youth programs. These are not necessarily extras. They're essential to the infrastructure to create healthy communities. So supporting young people to learn to like move, learn, and thrive in these environments is as much a clinical intervention as any medication that I would ever prescribe. And again, just thank you so much, everyone, for showing us really how health, culture, and sport come together to really build these stronger, more vibrant Pacific communities. Okay, I will turn it over. Thank you.
Aloha, everyone. Thank you for the wonderful opportunity to be here. I am zooming in from Washington, D.C., which is my current home. But I am Halaevalu Vakalahi. I'm the president and CEO of the Council on Social Work Education, which is here in Alexandria, Virginia. And that's the reason why I am zooming in from Washington, D.C. As the teen introduced earlier, I was born in Tonga, raised in Hawaii. I'm a Hau'ula girl through and through. So those of you who are from the North Shore, a shout out to all of you. One of the things that I really appreciated about tonight, Rohini, Jeremy, and John, you are truly the embodiment of the fact that we're not lacking brilliance, we're just lacking some opportunities. So thank you for all the work that you do and um, the pride that we all feel whenever someone represents us in such a wonderful way. So thank you, Rohini, Jeremy, and John, for all of your work. Mapauana and Krista, ditto, ditto, ditto on everything that you have said so far. And let me just add one thing that I think maybe that is sort of like a culminating piece that we'll build on as we move on to our conversation. This idea or the principle of always being futurists, right? So thinking about the future. And in terms of futures, we're talking plural. We're not talking singular future, but we're talking plural. The fact that leadership still matters. Leadership still matters. I spend the day today up on the Hill here in DC, speaking up for Pell Grant, speaking up for the loan repayment, speaking up for resources that's going to help our students get through school. So, as far as I'm concerned, leadership still matters, investment still matters, and education, it is still our best bet. So, everything that we're hearing, that we heard tonight, everything that we're going to do moving forward, um, we're going to need to constantly and consistently couch around what does the futures look like in plural, not necessarily singular. And then the last comment, both Krista and Mapauana alluded to it, is this idea that preservation is important. And I think for many, many of us, we have been in academia. I was in academia for 25 years before. I've been here for 3 years. Um, Scholarly contribution is a preservation tool. So every chance you get to put some of these work on paper, flood the global literature with it. Every chance you get is a preservation of something for our children's futures. So just a sort of like a culminating statement in terms of everything that had been said today. Futures, the fact that we're going to have to preserve some of these things, and it needs to be preserved through the global literature. And then finally, as Jeremy and Rohini and John were talking, I couldn't help but think about Ana Taufi'olungaki, who said in one of her major scholarly piece to stand up and be counted. Stand up and be counted. And she was talking about the Pacific. And I certainly hope that that's what we're going to do. Stand up and be counted. Preserve whatever we have that is beautiful and strength-based, And all of the work that has been done, I certainly hope that we're going to continue to preserve it to the futures. So with that, I want to open up the conversation.
Yes, the first question actually, Valu, and all the social workers here on the panelist, this may go to you. The question I saw was sports social work. Is that happening now? Is it a field now, or is it something that's coming, or where does sports social work fit in?
I think that's John's. That's the John.
John, any thoughts?
Actually, I heard this from my friend Teresa when I was in Honolulu, and we talk about uh, FAS, and then she mentioned sports social work. So as I study social work right now, I know the goal is to promote change. As our role as social work to make the world a better place. Social social change. So I just think sports can play a big role in that area to provide change in our society, community, and even that's also the goal of the Olympic, to make the world a better place. Thank you.
Mahalo, thank you. So I think actually it would be great as a closing from each of our speakers. If you don't mind saying one word about any final thoughts that you have as a speaker, I think maybe we'll work backwards, Rohini, and end with you from the speakers. So John, any final thought to connect the dots, and then we'll go to Jeremy, and then we'll go to Rohini, and then we'll go to Yoko if she has any final thoughts also as the co-host to close.
I just want to say thank you again for the opportunity to be part of this discussion. I look forward to learn more from the speakers and even the participants to move forward things forward. But just thank you for the opportunity. Thank you.
Mahalo, thank you. Jeremy?
I would like to reinforce what the things that Rohini and John were doing, and the things that contributes to the community. I think that's important. There's questions about social work at the end and sports or social work, because everything eventually wants to contribute towards the health of society and the health of the community, and preserving what's happening here in the Pacific. So I think, thank you. It's very good to hear from them too. And also thank you very much to the discussants, Mapauana Krista and Dr. Vakalahi, for their words. That was very well done. Thanks.
Mahalo, thank you. Thank you so much. Rohini?
First of all, thank you for having me here. It was a privilege to share my work with John and Jeremy and the discussants. Thank you very much for summing that up so well. My final words or my thoughts are, whenever we are approaching public health or any sort of scholarly work, I want to emphasize on intersectionality and just looking at the different sort of socio-cultural factors that might be at play, and also keeping in mind that no particular Pacific group and within that group is really a homogeneous group. So just keeping this in mind, having an open mind and thinking about divergently and ways that we can have culturally resonant and programs and pathways for. I know sometimes it can't be for everybody, but as many people, marginalized and minority groups as possible. So intersectionality is something I really want to emphasize on. Thank you.
Mahalo. Thank you.
I just want to say it was absolutely fantastic to hear the speakers, also to see people, leads, scholars, practitioners, students, types of different parts of the region. But there's some really important common threads as well. So I hope that we can stay connected and possibly find ways of further collaboration, that would be wonderful. Thank you.
Thank you. Just a huge mahalo. Thank you so much to all the amazing panelists. We send a great deal of aloha and appreciation across the times and the zones and everything and the great comments and all the collaboration that made this possible. Mahalo, everybody. Thank you so much for joining us. Have a wonderful day.